Pneumonia and the flu are two respiratory conditions that can have similar symptoms but are caused by different pathogens and can affect the lungs in distinct ways. Pneumonia is an infection that inflames the air sacs in one or both lungs, potentially filling them with fluid or pus, causing symptoms such as a deep, persistent cough, chest pain, and difficulty breathing. The flu, caused by the influenza virus, usually presents with a sudden onset of high fever, aches, and fatigue, along with respiratory symptoms like a dry cough and sore throat. Treatment for pneumonia often involves antibiotics if it is bacterial, rest, and fluids, while antiviral medications can be used for the flu, especially when taken soon after the onset of symptoms. Individuals with compromised immune systems, the elderly, and those with chronic health conditions are at higher risk for both diseases, which can become serious if left untreated. Here are detailed aspects of each disease for a clearer understanding of their characteristics and impact on health. Infectious agent, bacterial versus viral. Pneumonia and the flu are both respiratory illnesses, but they are caused by different infectious agents, leading to a crucial distinction in their management and treatment. Pneumonia can be caused by various pathogens, including bacteria, viruses, and fungi, but is most often bacterial in nature, often requiring antibiotic treatment for resolution. On the other hand, influenza, flu, is always viral, caused by the influenza virus, against which antibiotics are ineffective. Antiviral medications can be prescribed for the flu, and these are most effective when initiated early in the course of the illness. Recognizing the differences between the two, based on symptoms, chest x-rays, and lab tests, is vital for healthcare providers to administer the appropriate treatment. Anatomical location, alveoli versus bronchi. Pneumonia primarily affects the alveoli, tiny air sacs deep within the lungs where gas exchange occurs. These sacs become inflamed and can fill with fluid, causing a deep-seated infection that impairs the body's ability to oxygenate the blood. On the other hand, the flu, caused by the influenza virus, typically inflames the bronchi, the larger airways leading into the lungs. While the flu can progress to pneumonia, especially in the vulnerable or unvaccinated, it usually starts with upper respiratory symptoms. Understanding the anatomical distinction assists clinicians in tailoring treatment. Antibiotics might be critical for bacterial pneumonia, whereas antivirals and supportive care might suffice for the flu. Disease duration, acute versus chronic. Pneumonia and flu are both acute respiratory infections, but with differing developmental timeframes and potential disease courses. Influenza, flu, typically presents with sudden onset symptoms, fever, muscle aches, dry cough, and fatigue, and generally resolves within 1 to 2 weeks. Pneumonia, which can be a complication of the flu or stem from other infections, also begins acutely, but its resolution can be more protracted. Patients may experience chest pain, productive cough, and breathing difficulties. Recovery from pneumonia without complications can take several weeks, but the disease can become chronic or recurrent if underlying conditions are present or if severe complications arise. Understanding the duration and progression of these diseases is crucial for effective treatment and management. Symptoms, severity, mild to severe versus generally milder. Pneumonia often presents with more severe symptoms compared to the flu, which typically manifests in a milder form. Patients with pneumonia might experience high fever, chills, and a productive cough that may produce phlegm ranging in color from green to rust. Shortness of breath and chest pain, particularly when breathing or coughing, are also more characteristic of pneumonia. On the other hand, flu symptoms usually include a sudden onset of fever, body aches, fatigue, and dry cough. While both can lead to serious complications, especially in vulnerable populations, pneumonia's potential for acute respiratory distress and the need for hospitalization underscore its severity. Recognizing these differences is crucial for timely, appropriate treatment and improved outcomes. Potential complications: respiratory failure versus airway obstruction. Pneumonia and the flu, influenza, may initially present with similar respiratory symptoms such as cough and shortness of breath, but their potential complications can diverge significantly. Pneumonia, particularly when caused by bacteria, can lead to respiratory failure, as the alveoli in the lungs fill with fluid, hindering oxygen exchange and possibly resulting in the need for mechanical ventilation. On the other hand, the flu, particularly in severe cases, can cause inflammation and narrowing of the airways, leading to airway obstruction. This can be exacerbated if the patient develops a secondary bacterial infection, like bronchitis or secondary pneumonia, further compromising the airways and complicating the clinical picture. The knowledge of these potential complications is vital for timely intervention and treatment strategies, including antiviral medications for the flu and antibiotics for bacterial pneumonia, along with supportive therapies such as oxygen supplementation or mechanical breathing assistance.